There are situations, as you can observe in this video footage, where both the lower and upper lips may unfortunately tend to sag or droop down significantly. This often occurs when the patient's lips exhibit a certain level of looseness. This phenomenon occurs when the patient has a relatively large mouth opening and the lip tension is somewhat relaxed, allowing the lips to become a bit loose. In such instances, as demonstrated, the patient's gums are quite frequently obscured or concealed by their lips. The method to resolve this is to change the retractor size. Therefore, by positioning a large retractor and instructing the patient to close their mouth, you will observe that the previously drooping lips are now firmly drawn back and held taut, no longer sagging. Therefore, if you compare these two images, you will notice a significant difference in the degree to which the lips descend when utilizing a small-sized retractor compared to a large-sized retractor.